各位观众，大家好，欢迎收看港湾 TV。今天是12月2号，转眼已经是12月份了。今年2020年的最后一个月了，已经进入，时间也真快。我陪伴着大家，几乎也是从3月份到现在，已经有8、9个月了。希望大家我们每一个人都平平安安、顺利的度过这次plague。瘟疫，那么很多人不愿意说瘟疫啊，这个其实是疫情。那么川普总统说的最多的就是瘟疫。那么原来呢，这个大半年了，执行的呢就是疫情最严重的时候是周一到周六，是我记得是1356，好像是。那么现在呢变成是135了。很抱歉，上个礼拜四呢，我以为是星期四，所以真的没看，因为说实话，在跟大家在解说的时候呢，他有些关键的话呢就没听清楚，我也忽略掉了，因为以为毕竟是常规的，其实呢是上个礼拜开始就改成135了。那么礼拜五呢，正好这个有事，本来就是计划没有办法做直播，那么。礼拜一呢，是因为有一个很重要的美国的一个线上的一个活动，所以就没做。那么今天礼拜三，我们看看他们已经来了。先进来的是卫生厅厅长 Andrew Dix， 可能在新的一届政府里边，市政府里边还是卫生厅厅长。
To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. We're honored to be here on the territory of the Columbia-speaking people of the Songhees and the Esquimalt First Nations. We'll be doing a briefing tomorrow at 3 o'clock here in the Press Theatre in Victoria, and on Friday we'll be providing a written briefing with relevant information on COVID-19 in British Columbia. And with that, it's my honor to introduce Dr. Bonnie Henry.
很荣幸邀请 Bonnie Henry。关键的时候到了，看看数字是多少，是600还是700还是800还是900
？So for today,
今天是12月2号，他说
we have 834 new cases to report of COVID-19 in the province, 3 of whom are epidemiologically linked cases, bringing our total number of cases in British Columbia to 34,728 people. That includes 174 people in the Vancouver Coastal Health Region, 529 people in Fraser Health Region today, 20 people on Vancouver Island Health, 66 people in the Interior Health Region, and 45 people in Northern Health. We now have 8,941 active cases across the province, of whom 337 are in hospital, 79 of whom are in critical care or ICU. We have 12 new deaths to report today, bringing the total number of people who've died from COVID-19 in BC to 469. And my heartfelt condolences go to the families who have lost loved ones again today, and to their care providers, and to their communities.
住院是337，其中重症监护是79。
10,201 people under active public health
也是10201个是在这个监视中自我隔离。那么目前为止已经24000多例已经全例。又有3个新增的卫生急诊所。
Fraser Health Region at the Sandwich Peninsula Hospital in Vancouver Island, and the West Coast General Hospital in Port Alberni on Vancouver Island. In addition, we have 3 long-term care outbreaks that have been declared over at Cottage Worthington Pavilion, Discovery Harbour Centre in Orchard Manor, and at and 2 acute care units where outbreaks have resolved at Burnaby Hospital 3C and Langley Memorial Hospital for SC. That leaves us with 54 active outbreaks in long-term care and assisted living, and 7 in acute care. In both hospitals have other units that are still active. Our active cases in long-term care are 1,472, 926 residents, and 560 staff. In addition, there have been 2 new community outbreaks
那么现在有2个社区爆发
in Fraser Health and also
shelter 我们看到了一个
greenhouses where we have
一个是 greenhouse 一个是 shelter 就是庇护所这个是最容易了冬天到了 homeless 都要找这个庇护所
Today, you may have heard the United Kingdom has approved the first
他说大家都听到了今天英国是人类第一个新冠的疫苗的批准是辉瑞的
that other nations, including Canada, will be following.
那么其他的国家，包括加拿大，会马上跟进，马上会有疫苗。这个也是为我们带来的新希望，这个也是我们的一部分解决方案。我们还需要一点时间得到疫苗，但是至少我们已经有一个确诊，就是确认了证据，我们马上就要到隧道尽头。那么这个也是全民免疫的一个，我们也每一个人都要准备好了，我们全省也就准备好了迎接疫苗，这也是全民免疫的一个计划。那么还有一个我的团队啊 CDC 啊Ross 博士和我本人等等都是在马上只要是疫苗一来，我们也会批准本省的使用。所以这个也是我们在期待。
is taking a toll on all of us.
那么他也是说到了这个求全年新定以来是在过去10个月里边大家意识到夺去了很多的生命我们也是知道了我们哪里可以去哪些不应该去哪时候去大家都很疲倦了都很厌淡了这些事我们相互之间帮忙我们能够一起度过这个困难所以我在呼求大家继续再做多一点希望大家步伐减慢一点保护我们的社区保护我们的工作场所一直到疫苗来了再说希望大家能够保护那些特别有风险的老年人他们特别易受风险那么疫苗还没有来还有几个礼拜所以希望能够
And it takes lives.
那么这个病毒的脚步不会等我们，它会这个让生命失去，所以这个一定要搞清楚。
Our efforts of public health teams, our contact tracing,
同时呢，我们的公卫系统的工作人员，包括了跟踪接触的人员医护人员都是在努力，希望我们大家个人也做好自己的事。所以这个是很重要很重要的。
That these are situations where this virus can spread very easily.
因为我们知道现在这个情况，这个病毒很容易传播。只要你这个做得不好做得不规范就算你认为这个地方你是完全遵守行为规范了这设施都到位了。但病毒还会传播，所以我们希望大家不要在历史上现在最需要你不要到处走了，就是他说 stay local 就是在这儿就在本地，这样的话把风险降低一点。所以我们强烈的建议大家不要再出去了。希望大家这个考虑不要再旅行了这个重要性包括了这个只有保证我们的基础工作人员等等对吧？他们必须的，没办法。所以这个对大家来讲是挑战，也是困难大家想出去想到别的省去或者是去度假或者是去体育运动等等。我们当然我们也有一些体育项目会给他们去比如说一些冰球队到内陆去到阿省来来回回但是已经有一些感染了所以我们必须停止了要保护我们的社区你们体育运动也不要去了什么锻炼它 recreation 就是锻炼了也不要锻炼了这个是希望大家继续保持这个措施希望大家立刻行动了 也是为了你的团队，也是对你特别是你们的这些健身的这个大家看到了，这个时候是最容易感染病毒的。那么同时呢，也是那些度假回来的家人，也是的大家度假很重要当然了，很重要的。那么希望大家能够落实我们的卫生命令，所有的卫生行为规范和指导，希望大家都能够遵守社交规范避免人员聚集我不能再命令大家这个不能做那个做了，已经该命令都命令了，所以希望大家能够强烈的呼吁大家能够待在家里就待在家里，来保护我们的家庭社区使得我们的病毒在社区里边不要再传了也保证我们的医疗资源，保证我们的医疗资源向这个老年人倾斜，希望大家能够往回走，再往回走好不好？求求你们了。那么有关这个人员聚集的命令今天又会有新的命令，我们会发布这个包括了很重要的具体信息，包括了体育运动所以我也是提醒大家所有的项目，所有的那么到12月7号大家记得吧，这个是一个阶段，12月7号以后我们还会看我们这个强烈的这个阻止大家之后的效果那么大家可以我知道现在马上度过节了，大家也要看灯或者是要出去结伴请大家停止了，没有任何例外了，希望大家遵守那么特别是这些婚礼啦、葬礼啦最多10个人，没有其他的了。那么这个是在11月19号颁布的命令以外，包括的运动的禁令以外，我们还今天有详细的新的这个命令发布，请大家到我们的网站上去看。同时我也请求鼓励大家多走出室外就算要集聚出去，也是家庭成员一起出去
particularly sports, there's to be no travel and no spectators.
特别是体育项目不允许有旅行，不允许有观众，也就是说所谓的旅行就是你从这个地方到另外一个地方去比赛，不允许了。我们希望大家继续保持，继续遵守我们的行为规范。那么很多的室内的这个活动因为他们室内的更加有风险更大，也不是能保证所有的人遵守我们的行为规范，所以这个是很重要的命令，希望大家不要在室内了这个说到这个呢我们接到一个很热心的网友打来的电话，指出了我翻译当中的错误，我对大家表示诚挚的感谢，和也向这位网友表示诚挚的感谢，也是给大家道个歉。上次Bonnie医生说了，就是祖父母可以去接自己的孙辈，是可以接的，我听成了不可以接了这个意思是完全相反了，对不起大家因为毕竟呢有时候在说这句话的时候，他下一句话只听了一半。
high intensity interval training and others.
那么他说也是说到这个瑜伽啦等等这些高密度的不允许了也低密度的可能允许的但是也是停止了室内的不允许了。我们还有一个新的对这个成年人的体育团队的比赛也有一个新的命令，就是禁止了。
What we will be focusing on is structured programs or sport for children and youth.Recognizing how important those are for our young people.
同时我们也知道体育运动对孩子们对年轻人的重要，因为他们在增值身体，所以现在这些运动都回到了第二复工阶段的第二阶段的命令所有的详细的 今天晚些时候在我们的 BCCDC 网站都会有。我也知道这个会给大家带来额外的负担，因为我们现在已经是很困难了看上去好像还没有结束，所以这个不要再继续了我们就算是觉得很疲倦了，已经很厌烦了，但必须这么做我们知道这条路是很困难的，但是我们必须走下去我们必须团结起来，共同努力。我们这个共同面对我们神，也面对这个挑战。我希望大家能够做多一点，能够勇敢地面对这些挑战，多做一点点来保护我们所亲近的人，保护我们的长者，保护我们的老年人。希望大家从现在开始每天每一点一滴的进步都会是加强我们的所有的力量来抗击这个疫情所以希望也是3个 be kind, safe and calm这个就是大约的意思Bonnie Henry 说的还是挺好的，当然很多人也有一部分人反感他，也有一部分人喜欢他，有一部分人质疑他，因为阴谋论说这个很多的数字不对不作为等等这个都是仁者见仁，智者见智没有对和错的，这个每个人的意见都值得尊重。那么卫生厅长也是说到了这个过去死亡12个人，哎呀，现在天天是十几个，真的是太。我记得6月份、5月份、6月份到7月份的时候，有一段时间是没有死亡。他也是说他说我和 Bonnie 医生每次跟大家说没有死亡的时候，这种心情是多么的愉悦，多么的轻松。哎呦，我现在突然想起来他说这种话，现在你看10几个，所以我多么的渴望我们明天就听到他说，我多么的开心，说今天没有死亡，没有死于新冠病他说我们也听到了你们，我们也看到了你们的痛苦。他也是说到了这个12个过去24小时也都主要是还是长期护理院的52个长期护理院的爆发，这个是厉害54个说错了。这个他说大家那个对大家的挑战也是很深刻的、很根本的，所以不管怎么样的情况今天Bonnie医生今天说的新的这个命令，特别是对长期护理院以及体育运动项目已经
are in the latter category who've had outbreaks declared over, and the anxiety that everyone involved in outbreaks feels. This week has been Monday and Tuesday and Wednesday, an extraordinarily difficult week for everyone involved in this. And it should remind all of us, I think, of what we have to do together right here and right now in this period before the prospects of a vaccine come.
这个团结2个字呢，他们英文里边有很多说法 ，together 是最简单的integrity 这个就是，但是我们加拿大人呢说话的英文和美国的英文还不一样，就是加拿大的英文的用词不如美国用词多这个有点像英国，美国人的用词多一点。那么他也是说到，请大家看到了我们省的我们国家的其他省都是差不多。的，那么同时魁北克呢，他也是说，他也用法语说了一下，就是魁北克今天发布的一些措施什么都和差不多。
Que ce soit à travers, à destination ou en provenance de la province, ramène le virus avec eux. Ce sont des choses que nous devons absolument éviter. Il est essentiel de rester ferme dans notre engagement à protéger notre province. Nous ne pouvons tolérer des lacunes qui pourraient faire reculer tous nos efforts jusqu'à présent. Pour l'heure, tous les déplacements non essentiels sont fortement découragés. Cela comprend les déplacements vers d'autres provinces ou territoires au Canada.
那么我再给大家重复一下过去24小时的数字，834例，现在累计是34728例，其中沿岸增加了174例，飞沙卫生局新增了529例，岛上卫生局新增了20例。北部内陆卫生局新增了66例，北部多一点45例了啊，因为那边人相对少。那么他也是说到了今天这个重新招聘这个跟踪接触，现在是有多少个现在已经1096个了啊，已经招了1096个已经招了。那么他说9月份计划是招500个，那么现在已经是超过了12000个职位已经空出来了啊，那么现在已经招了1072个了啊，这个跟大家说一下，也是因为跟踪接触工作人员的工作很重要，只要发现疫情，马上就跟踪接触，然后通知。那么希望大家也是。
Health representative positions to support culturally safe contact tracing. There are also 382 candidates at the interview stage for further positions and 113 in the offer process. We would like to thank everybody who stepped up and everyone involved in this initiative, which truly is extraordinary. And finally, I'd just like to note, to talk about seniors care, that under our plan to increase
那么最后呢，也是跟这个长期护理院的员工说一下啊，我们也是给大家明确的信息我们政策也是倾斜到这个资源政策都是倾斜到长期护理院。我们现在有54个长期护理院爆发所以大家都可以看到了，任何一个方面，我们的资源都向这个长期护理院倾斜。所以我们的目的就是要减轻长期护理院的爆发情况。那么还有一个事情要告诉大家。
The recommendations presented to me by the Deputy Minister Stephen Brown with respect to PHSA expenses.
明天也是给大家说更新一下这个我们这个设备的这个护理抗疫的资源的准备情况。
A couple of weeks ago. Those orders, I think, have been overwhelmingly respected.
那么他也是说到了伯尼医生发布的这些卫生命令持续有效，希望大家不要尝试着去破坏或者不遵守，希望大家遵守，极力遵守越来越这个时候越要遵守。不要在室外有任何的聚集了，不要了不要不要了，没有在室外有聚集了，没有了。上次这个命令说过了，你就算在这个 backyard 都没有了啊，这个没有了，没有什么backyard 允许的，夏天是可以的，现在没有了。我想想也是对的，因为很多人到你家去 backyard 聚集也是要从这个室内走的你就比如说上厕所等等，所以这个是不允许了。现在。那么他也是说到了，也是感谢我们本省的省民以及这个各社区的领袖那么现在这个疫情真的是不可想象的困难。我也是感谢每一个公共系统的工作人员他们做的额外的付出，额外的艰辛努力所以感谢每一个人我们认识的不认识的所以我们都要希望大家都能够真正面对我们的所有的卫生命令，请大家严格遵守希望我们能够顺利的度过这个困难的时期不要有任何的损失不然的话你不遵守的话就会有更大的损失。这个人的生命是最大的损失每一个人都要参与进来的，不能说我置身度外，不可能了。所以希望大家也是相互支持，相互理解，相互帮助，能够度过这次困难的时期。
Thank you, Minister. As a reminder to everybody on the phone, please press star 1 to enter the queue. You're limited to 1 question and 1 follow-up. Please also take your phones off mute. You are not audible until your name is called. First question today is from Tess Van Straten, Check News.
Hi, Minister Dr. Henry. Given that we're still seeing unchecked transmissions and high numbers, is it likely you'll need to extend the event ban past December 7th?
That is something, of course, that we're looking at. I think we
他说10月2月7号以后怎么办？因为现在的很多还有传播率很高。他说我的团队呢现在已经还没做决定，我们现在是在看很多的选项，考虑很多选项。那么我们现在还是要到礼拜1再看这个周期结束，我们才能够做这个决定有哪些选项能够去做。
Yes, I do. Thanks. And given travel is still such a big issue and people are coming to Vancouver Island and the Gulf Islands,
那么这个省内旅行的问题的很多到岛上或者高尔夫
to be asking people before they board the ferry.
那么还有很多都是省外的牌照，还是省外的牌照的问题。他也是说过无数遍了，他说这个很困难，我们不知道他们这个省外的牌照的人到底是在还有些他为什么要旅游有些是这个必须要旅行的理由这个对这个对渡轮的工作人员也是很困难去甄别一个一个原因是什么。那么这个是我们大家共同的义务你们的责任，这个是大家的责任了我们是每个人根据自己的需要去做了这个就很清楚了，就是没有强制了，不像中国不能动就不能动。
This question primarily for the minister from my colleague Shannon Patterson, and this is around the idea of making vaccines mandatory or maybe a requirement for certain settings or jobs. So once a vaccine is available, should people who work maybe in healthcare and long-term care be compelled, whether legally or otherwise, to get vaccinated as a condition of employment, or what's your vision for how this might work?
So I will actually take that on because that is something that is part of my area of focus for many, many years. So we have no mandatory immunization programs in this country and in this province, and we do not expect that COVID immunization will be mandatory either. Having said that, there are some key positions where we know the risk of transmission in long-term care, for example, in some healthcare settings, can be very high. So we will be strongly encouraging everybody in those settings to be immunized. And if people are thinking of going into those settings and don't believe in immunization, then they should look for other things to do. But these vaccines are going to be, I have full confidence that these are going to be effective and safe vaccines when they are ready and approved for use here in Canada. And I know that we are waiting for these, particularly in those areas where people are most vulnerable, and we can protect people very rapidly using these new vaccines that will be available very soon, hopefully.
David, do you have a follow-up? Oh, sorry.
I do, Dr. Henry.
No, sorry, just...
We had this discussion, I think, 1 year and 7 or 8 months ago about this question around measles immunization. And what has proven effective is engaging with people, and that's what we're going to do in this case as well. I think it's nice to talk about a situation of broad immunization, and we're looking forward to that. Initially, we're going to get the vaccine that we get and make the decisions based on public health advice required to deliver that vaccine. But we'll be providing lots of information for people and support for people because, and the way to do that is to engage,
说到这个疫苗的问题 Bonnie Henry 今天也给大家信心了。他说大家或许听到了早上英国批准的人类的第一支辉瑞制药的这个疫苗，那么他说我们其他国家也会跟进，包括加拿大，所以他们已经准备好了这个联邦采购 BC 也采购，那 BC 省马上会批准，当然会批准了。当然从法律角度来讲 BC 省要独立的批准，因为我们是独立的。大家听了很多了 它都是 jurisdiction 就是法治地区。那么 BC 省和 Alberta 省都是独立的法治地区，所以也是需要 BC 省批准。BC 省谁批准呢？可能就是 CDC 的批准。
David, do you have a follow-up?
Bonnie Henry 是 BC CDC 的头。
Choir has gone virtual. They've done a creative and catchy rendition of All I Want for Christmas Is You. They've turned it into I Will Social Distance With You. So one of the lyrics, I want to hear your lovely tone, but only over Zoom or phone. You know what's coming? This is for the minister too. I'm not going to ask you to sing, but I do want to know this in the spirit of the serious message of what the members of this choir are trying to convey. Dr. Bonnie Henry, what do you want for Christmas?
也是这个你请大家给大家一个好的
You know what? I've heard that, and thank you for not asking me to sing because it would be horrific. It's not one of my skills.
他说疫苗方面呢
I think it's a fabulous choir, and I have seen so many wonderful words of support and people engaging in this, and we need to have that joy and that humor and that in our life through this hard time.
要乐观的去面对这个
what I want for Christmas is everybody to stay home with their family
我希望大家待在家里安全一点，能够共同的虚拟的共度与亲人共度这个圣诞节。你可以幽默，可以唱歌。等等等等啊，他说伯尼森他说他不强项，他这个方面不是强项。
The field hospitals, no. We have hospitals in a box.
那么他也是说到了这个 field hospital 就是战地医院，也就是临时的这些医院。他说我们没有，但是我们有一些移动的移动的，这也是中国人说的方舱，其实这儿不适合方舱医院那么他也是说是这个像类似于红十字医院那种。他说我们这种红十字帐篷这种这个也是一些其他的帮助设立一些移动的，因为那些不重要的临时住院的。就移到那边去了。
And so those are the types of skill sets that will enable us to focus on the key medical and clinical things that we need to do.
因为也是其他的这些呢，都是一些其他的团体组织帮我们来设立。这样的话，我们的公卫系统呢只关注治疗病人。
Red Cross and other community organizations. And in terms of our vaccine planning, we've been talking with Red Cross.
因为我们现在还要通过红十字会还要分发疫苗等等，包括国防部都是协同作战。那么这个也不是他能够解决的，也是卫生厅厅长能够解决的。他说 BC CDC 也是在积极的和红十字会一起合作，因为红十字会都有一些长期的这个义工，能够持续的帮助，包括了在这个包括了一些接触跟踪工作包括在这个会展中心设立一些临时的诊所等等。
At present, our issue in critical care, for example, is difficult in some particular areas where there's slightly less critical care.
那么他也是说到了这个重症监护是比较特别的因为这个也是有些人要转移出来，转移出去，这个是说有些额外的要求。
In terms of beds is fine right now. We're in the 50 to 55% range of occupancy if you count base beds and surge beds, and equally
那么现在看来这个也是占用率是55%到55%，那么有时候是70是70几
are looking to increase
所以有时候呢这些临时医院我们可以暂时叫做战地医院有时候是需要的，那么这样的话他们就会设立起来，通过红十字会的协助那么他们现在还不是很重要的去寻找这个方式这个不是很重要的去寻找这个方式，主要还是这个会展中心那边倾注重点。
Yes, yeah. So people who do logistics support, so help organize things.
那么他说红十字会呢可以给我们一些物资分发等等这些工作包括搬运等等他们因为很有经验这方面的工作。
Rob Brown, Dawson Creek Mirror.
Good afternoon. The provincial I guess conditions that were initially just for Fraser and Vancouver Coastal, that they were then again spread to across the province. Obviously, the Fraser or Vancouver Coastal numbers didn't go down; only increased with the move. With those conditions, and obviously that seems to be playing out across the province now. What are the next steps in the provincial playbook?
他说，这个沿岸和飞沙卫生局的数字持续增高，那么你们措施怎么办啊？马上就要到过节了，你们还有什么额外的措施吗？那么他说，大家可以仔细看看，其实这两个地区已经慢慢下降了，但是还没有完全的下降。
The increase has been primarily. If you look at it as doubling time of cases, where we're seeing the most rapid growth is in the north.
那么他说，主要是看到了翻的数字急速的增生的，其实是这额外的地区，比如说北部内陆啊，我刚才说了，北部一下子会45个啊，这个也是。
That movement around the province, and it's slightly different in different areas.
所以他说每个地区和地区还不一样。
The infections, but
所以这样的话还是
the main things that are driving transmission in all of BC.
但是现在所有的所有的地区的传播方式还是主要是社交的接触。所以我今天还是这个命令我要求的，我们还是要求我的团队重新看，我还要呼吁大家。重视这个其他的地区
，so we are still looking at those in some detail.
所以我们还会具体事情具体分析。礼拜一的时候还会有一个具体的措施出来，因为现在还为时尚早。但我不觉得为时尚早，已经2个礼拜了嘛，差不多2个礼拜。所以这个先生问得很好，马上就10天了。那现在这个2个地区数字没下降多少，当然伯尼医生说在下降，缓慢下降。
Concurrently, that had over 100 people each, and this was some sort of rally against tyranny. You mentioned yourself we've had some hockey players or hockey teams heading to Alberta, and we've got Canada Post people claiming that they've been to Alberta up here as well. At what point does the province stop using the word fatigue, and we're all fatigued, and start drilling down and using words like ignorance and getting. Not that there's going to be more stricter orders, but at least getting more front and center when it comes to, as other provinces have, speaking out against some people and some groups not following orders in any way, or in fact outright breaking them.
I know, and it's really difficult to see small groups of people, 100 and whatever. We saw some church groups on the weekend, but we have to remember that those are very small. If visible and vocal, they're not the majority of people in BC, and we need to focus on the fact that most of us are doing the right thing, and it is.
那么他也是说到了，大多数人还是做的正确的啊。那因为这个刚才这个记者问的就是人员聚集的问题，包括宗教活动啊、场所啊等等。那么他说，大多数的人其实还是遵守我们的卫生命令。
Implemented some of the measures that we've needed to take to close down places, to disperse gatherings, but I also believe that in a crisis like this, if we appeal to people's better natures, that comes out. If we give people the things that we need them to do and the means to do it, the most of us have shown time and again that we will do what we need to do to protect our families, to protect our communities. And it's a very small group of people that we often focus on that causes outrage. And it does. And it makes me upset when I see this sometimes, knowing how many people have died in our long-term care homes, knowing how hard our healthcare workers are working every single day, and how everybody is tired. It really makes you angry to see these small groups of people who are trying to make
很多人对这个结果比较失望和愤怒，所以这个一定要看清楚啊！我们希望大家相互支持，也就是中国人的话了，不是1-2颗老鼠屎就坏了一锅粥。
The vast majority of people in BC
他说这个绝大部分真的是做得很好。
Next question is from Marcella Bernardo.
这个是没有问题的。
Hi, Dr. Henry. I wanted to ask you, in keeping with what you just said, we're still hearing from parents who say it took up to 7 days to find out that their child may have been exposed at school, And you mentioned last week that there are efforts being made now to try to report that information in a more timely manner. Where are things at now in trying to get those exposure notices up as soon as possible?
Yeah, so our focus is obviously on making sure that the families and the school community is notified as soon as possible and that those are posted. And there's been quite a lot of work with the school districts, with the Ministry of Education. My colleague, Dr. Reka Gustafson at BC CDC, is leading that with a team particularly focused in Fraser and Vancouver Coastal, where we know most of the schools and the transmission events are happening. But it is important across the province, and we are making progress in terms of catching up. Sometimes it's a challenge because it may take time before somebody is tested, before we recognize that they're in a school situation. So it is not always possible, and now because we give people text messages, and they may get their own results and share them with people before public health is even aware. But that's important. We now know how to manage these, and I know there's tools that are being developed and shared with principals, with schools, with families, so that if you do get that notification, you know what to do to keep your family safe, and to know what it means with an exposure event. The other thing that we're looking at, of course, is the data, and it's still, though we have quite a lot of exposure events where people have been in the school setting, there still is very rarely transmission in those settings. And if it is, it's mostly to one or most two other people. And we've had very few outbreaks, as you know, and we're trying to learn from all of those. So it takes time, but it is getting done, and I'm really impressed with the work that's been going on so far.
他也是再一次确保了学校这个措施到位，而且他们比较重视学校。那么学校的环境到现在为止，学校的传染情况还是低。这个他在说实话，我孩子的学校已经是4次还是5次 exposure 了。我觉得作为家长也好，作为孩子也好，都麻木了。但是他们天天戴口罩，那个这个还是遵守的。
avoiding questions and that you're trying to deliberately hide information.
那么他也是说到了，有人怀疑他就是 Bonnie Henry 隐瞒信息或者刻意误导，是不是有没有这个情况？
Can I suggest that maybe you don't follow Twitter quite so often?
他说你可能没有完全跟着我的推特。他说我们从一开始就会对大家公开，所有的信息都公开的。
People who are expounding at city council meetings here and there.
大家都开了很多的什么这个市议会啊，这个 downtown 的会嘛，大家
any of the families who've lost a loved one.
还有很多流传的这种各个谣言传言。那么大家都可以看到真实的事情，大家可以看到了，我们给大家图表、地图、模型我们每天的 CDC 的这个dashboard 上次有网友提供了很好的这个中文翻译这个数据表，我们每天都有，每个礼拜都有这个跟踪这个检测的数字包括了这个还有很多的地区及时分布的、及时公布的暴露情况我们当然会有很多的阳性案例会出来，我们也要收集我们也是对每一个人都会，大家都想一想，每一个案例我们都要去跟踪了解跟他们交流他们哪里去过了，他们哪里可得到了你跟哪些人去过，跟哪些人接触过所以这个有些人还是紧张，有些人还紧张，特别是一些年轻的人他们也是比较心情紧张所以有些因为年轻的人也有坐在医院里边病重的，也有到重症监护去的。
But that has not been the case in other parts of the country and the world. So when people are worried about their own health, they want to know what to do for their own symptoms, and they want to know about their family. It takes time to get that information. So we don't systematically collect all of the information that we'd like to, like information on ethnicity and disaggregate it by race and income and all of those things. So we have to use other measures to get at some of that information. And we present that in the modeling we present in the data that we got from the survey and from other ways of trying to get understand the impact of COVID and the measures that we're taking on people in BC. But all of the data that we have is
individual 每一例都要去了解哪里去过，跟谁接触的确就这些人我们不是中国有那么多人的去做这些事情，的确因为毕竟也是我们纳税人养着，这个队伍不会大，那么工作量是很大的
Since Seniors Advocate Isabel McKenzie released her report on the impacts of restricting visitors among other measures, when can we expect to see decisions made either from you, Dr. Henry, or from the province on how current designated visitors can visit more often and perhaps in residence rooms as well?
Yeah, so the challenge that we are facing right now is that this surge in our communities has dramatically increased the risk in long-term care.
那么长期护理院不是有一个特定的访问区吗？那么这位记者问的就是这个问题。那么他也是说到了现在这个对这个长期护理院的冲击特别大急剧增加，所以现在呢，我们还在维持不会增加这个探访区域这个也是一贯的。那么但是呢，也会现在这个风险高的时候是不允许再扩大他们的社交老年人的社交，就是长期护理院的这些。那么这个也要区分，有些是基本的访问者和以及其他的访问者还要区别开来。那么我有一个邻居，他的外婆已经92岁了。这个老外这儿的老外就是已经深深体会到长期护理院了，因为我们都是第一代移民，都没有体会到。那么我这个旁边的老外，他的外婆就92岁，他自己的妈妈都是65岁了，他的外婆有3个子女，现在就是他的妈妈只有一个指定的，所以只有一个人92岁。那么他说他的妈妈现在他外婆还是健康，神志清楚，还会用这种 FaceTime。那么其他的人呢，真的是可怜我们对不对？不能理解。所以为什么大家可以听有很多的记者问这个长期护理院的问题
？Parental or guardian oversight, why aren't masks mandatory in schools right now, as we're seeing in other provinces with even more difficult pandemic situations right now?
那么也是说到了，问到了学校的口罩为什么不是强制的？那么他说，因为学校里边的设置，戴口罩是必须基本的，所以上次说过，学校不是公开的场所，所以可以不是戴口罩。但是他说，其实他说很多的学校的很多地方都必须戴口罩的这个过道必须戴口罩的等等他说你们仔细看看学校的具体的包括我们的这个行为规范都有网上都有特别是那些孩子小的因为越小对于他们来讲就是不是强制的当然我们要鼓励他们戴口罩因为我们要让他们安全也鼓励这个家长戴口罩老师戴口罩那么同时保持这个距离远一点能够远一点
congregating outside
那么大家可以看到了在室外这个大家集合的时候必须戴口罩的这个是强制戴口罩的这个是在室内的公共场所是的孩子们必须是戴口罩这些地方必须戴口罩
We have time for one more question today. For everyone listening, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For updated information about the province's restrictions, visit gov.bc.ca/regional restrictions. And for information about the province's new orders and pandemic supports, visit gov.bc.ca/COVID-19. Last question today is from Zara Premji, CBC.
Hi there. So, Dr. Henry, this one's for you. Can you give us a bit more information about the team that traveled to Alberta? Where did they travel from? Was it a kids team? What is the age breakdown of the people associated with that team who are now infected with the virus?
I'm not going to give them away, but because I understand from what I'm hearing from my colleagues around the province, it's not unique. But I will say it was an adult old-timers hockey team that felt it was important to continue their travel and games across the border. And these are, that is unfortunately, for many adults, it's a very important part of their socialization, and that right now is risky. So those types of things cannot happen, and it meant that a number of the team came back and spread it to their family members in their workplaces and in their community.
昨天到今天24小时里边新增了834例，其中3例是 Eplink 呢，BCCDC 有定义的，也就是我们中国人说的疑似，就是他没有阳性，但是确诊应该是过去的根据症状以及他去过的地方。应该是阳性的，所以叫 Eplink 是3例。
So it cannot happen.
那么总共呢就是34728例了。
I do, thank you. So you did mention obviously that this spread into community as a result. So when you say it impacted the community, how far did it spread within the community as far as how many people tested positive or in isolation as a result? So we can get that bigger picture and understand this. And can we also get the response in French too?
那么他也是说到了社区感染的这个大概描述啊，能不能有？他说我这个数据现在没有，手头上没有。
That are similar to this, and we presented one from some data that
他说我们过去有时候也告诉大家，这个模型分析的时候
，a group indoor fitness activity
有一个案例记得吗？在菲沙卫生局下有一个健身场所一个人他传了家庭，传给了这个家庭以及长期护理院等等等等。
chain of transmission from this
那么就是因为这个是变成了第二例、第三链、第二链、第三链。
That it was several dozen families that were affected, several businesses that were affected.
所以这样的话呢，导致了很多的家庭啊、生意啊都受到影响了。那么可能卫生厅长说法语了，那这个问题不大了。那么过去24小时里边新增了834例，累计到现在是34728例，其中沿岸卫生局新增174例，这个菲沙卫生局新增了529例，这个岛上卫生局新增20例，内陆卫生局新增了66例，北部卫生局新增了45例。刚才呢，伯尼医生在答记者问的时候也提到了一个问题，也就是记者问沿岸卫生局和菲沙卫生局数字还是这么高，你们这个措施已经这么严了，因为这2个地区其实到现在已经快1个月了。那么为什么你们还有进一步的措施有吗？Bonnie Henry 呢提到了一些，第一，现在要到12月7号，现在还为时尚早，我们还有很多选项，但是呢，要到12月7号以后才看，要具体情况具体分析。第一，第二，就是说这2个区域现在的曲线是在缓慢下降因为我们不清楚，他们清楚啊。第三，我们省的其他卫生局的情况开始上升了，而上升的速度很快。这是刚才伯尼医生给大家的一个具体的一个答复。那么目前为止，现在这个记录在案的活跃的案子是8941例，住院的呢是337个住院，重症监护是79例。过去很遗憾过去24小时里边有12个新增死亡，那么目前为止是469个死亡了。那么明天不是星期五，是明天周四这个时候他们还会同样的时间、同样的地点再给大家做新闻简报。那么各位观众也感谢大家的收看，今天的 BC 省新冠疫情的新闻简报就到此为止，我们下期再见。